As many of you know, we recently had a patient on our unit who presented some difficult and aggressive behaviors. This patient exhibited violent behaviors in which he assaulted a security guard, resulting in the patient to fall. He was thus restrained and given sedative medications. While the use of restraints are sometimes necessary, using restraints can lead to longer hospitalizations, according to Richmond et al. It has been shown that a 3-step verbal approach is more effective than restraints and medication in interviewing and agitated individuals, also from Richmond et al. We are not alone in this matter. This is a nationwide problem of violence in the healthcare setting, according to Tishler, Reiss, and Dundas. That is why our unit and its employees need to be better prepared to handle an agitated patient, and we must know the key steps to de-escalating a patient. If we become more versed in de-escalation training, we will be able to communicate better with patients, resulting in a decline in these types of assaults that we see, with the help of source Tishler et al. I'm going to present to you some basics on de-escalation techniques. De-escalation is a continuous verbal interaction between both patient and caregiver. It can help calm a patient who is becoming anxious and agitated. This process can happen in as little as 5 minutes. Here are some key points to keep in mind while engaging a patient in de-escalation, according to Richmond et al. First, you need to respect the patient's space. This generally means keeping about a 2 arms length between you and the patient. This is useful because it can help to make sure neither you or the patient feels blocked in. Second, stand in a calm demeanor with hands unclenched and visible, and don't stand over the patient. You should be able to be at the same level as the patient if possible, and this shows that you're open to communication. Third, establish verbal contact, where one person communicates with the patient. Having one person communicate will avoid confusion to the already possibly confused and agitated patient. You need to use concise and simple vocabulary. You may need to repeat your message, providing options and alternatives. And again, this concise, simple vocabulary can help for the confused patient. You should identify the patient's needs and wants with body language. It might be helpful to think of a time when you cared for the same patient and think of what they may have needed or wanted in the past. You should actively listen to the patient and assure that you're telling them the truth. This projects less judgment and will help engagement with the patient. Next, find a way to agree with the patient or even with what the patient is saying in principle. When de-escalating, we need to set limits of appropriateness. This can help show respect, and it can show that you want to help the patient control their behaviors. We should offer choices to the patient. For example, you can take this medication in a pill form, or I can give you this in an injection. This can help empower the patient, which might help bring optimism to the situation. And then finally, with de-escalation, we should debrief the patient and the staff, which might include explaining the need for medications that were given in this situation. That is just a brief description of the techniques of de-escalation. I encourage you to explore de-escalation further, and I have left a list of my resources that I used for this presentation below for you to further explore and learn about this topic, which will be helpful to our unit. Thank you.